then the external oblique. Then after that, you have the PSIS, sacral edge coccyx. You will target the gluteus maximus. Then from the SIS, PSIS, and the crest, you have the croissant for the gluteus medius. Okay, raindrop just below the croissant and the greater trochanter. Go as anterior as you can. You have the gluteus minimus. Okay, then you have the attachment of piriformis on the tip. The front you have what? Gluteus minimus. Posterior you have medius. Okay, and below in the gluteal tuberosity area you have the maximus. Okay, and now we need to target the quadratus femoris. Okay, so the quadratus femoris, once you release the muscles around the greater trochanter, you look at the tip and the posterior aspect, okay, and go a little bit inferior, and I like to bring the glute max into a lax here, okay, and now I'm going to work the quadratus femoris right posterior to the gluteal tuberosity. I soften the gluteus max, and now I'm going for the muscle base just deep to it, and my vector of force is pressing the muscle towards the posterior aspect of the quadratus femoris. Did you get that? I'm gonna repeat, okay? I'm going for the quadratus femoris, which is a deep rotator that inserts onto the posterior aspect of the greater trochanter. Can you picture it? It runs about this way, okay? But it's deep, especially if I bring the hip in lateral rotation to relax the gluteus max, it's gonna be even more under, okay? So if I don't bring the gluteus maximus into a lax, I'm gonna do a lot of work, probably bruise her before I get to the quadratus femoris. You don't want to do that. But greater quadratus femoris is right in here. So to make my life easier, I bring the glute max in the lax position. It's soft, I can penetrate. My vector of force is from posterior to anterior, but as deep as I can. Okay, and I'm pressing towards the bone. Okay. You see it's posterior to anterior? Are you with me?
Trying to picture it.
We'll show you on using the Essential Anatomy 5 app. Okay? But this is traumatic. You could play with joint. You can't go crazy with that stuff, okay? But we try to keep it simple right now. So your goal right now is to be as precise as you can. And from that moment, you can be as creative and use all your knowledge that you can, but understand that you're targeting origin insertion to release the muscle to decompress the joint. Okay? And later, Clarissa will add techniques precisely onto the muscles, but now that you know exactly the origin insertion, the rest becomes a piece of cake. Okay? Let's have a break, just in case some of you need to move your car. Okay.